Good morning, friends. Today I am going to speak about night sleep, and which is most important because we need around 6 to 8 hours of sleep daily, which will reduce our keep away from hypertension, diabetes, irritability, and other psychological diseases, and so many things. Our proper sleep is most essential. In that, I am talking about snoring. Snoring is precursor of obstructive sleep apnea. There are a lot of things which we can come out and we have a nice sleep, and there are so many complications of snoring. One should not ignore this. This is a global problem. It is not only subjected to one religion, one race, or one province, or if it is India or Asia or America, Japan, wherever it is a problem of globe. Hence, we have to, and it can be, if we have to be determined to solve this problem, because the most affected people are the sleeping partners. That is the spouse. Spouse will be affected more. Hence, we have to take care of our spouse, sleeping partner, roommates, and everybody. They will get disturbed, and not only ourselves will get disturbed sleep, they also will get disturbed sleep. Not only this, on our health, this snoring will cause so many complications. To avoid that, we have to change our lifestyle. We have to do regular exercises, and most important thing is we have to determine that we are going to do it, and we are going to solve our problem, not like getting operated, getting these medicines. Without medicines, without operations, I am going to reveal you the types which where we can do it without operation and without disease. And if it is really a pathological issue or congenital issue, and there is no other chance, we have to go for operative thing. That's why I insist on these the what are the points I am giving you. These will definitely help you. If it is a mild case, definitely you will get relieved. And if it is a really some serious case, it will become a mild case. And there are so many devices which have come into market to solve this problem. And if it is very severe cases, there are machines have come, BPAP and CPAP machines have come to solve the problem of snoring. That's why all the best, get determined, and we will solve the problem. Hi friends, now coming to the exercises which will help to relieve snoring. These are definitely will be helpful. Now coming to the tongue exercises. Tongue exercises is number one is sliding. Sliding is just touching the tip of the tongue and moving sliding along the palate. This will help to remove the fat of the fat present in the tongue, reduces the amount of the swollen tongue into a small one. Patla tongue bolte हैं ना वो. Then we can have that airway so that it will not push back, it will not fall back and cause any problems. Now I will show you. You take it your tongue to the back to the palate and slowly slide it to the front. This you can do it until you are exhausted. This is the main thing. Second one is protruding of your tongue. That is, you can protrude the tongue as outside as possible. Ah. Now, the third thing is you can push the cheeks. Both the cheeks with the tongue so that your muscle tone of the tongue will be more, tone will increase and there will be fat which is present in the tongue will be reduced. Now, and you have to do gargling for 5 minutes. This is the same. And one more tongue exercise is saying la, 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 la. Yeah, this is the tongue exercise. Now you can say pa, 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 ba, 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 ma, 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 na, 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 na. These are the few of the exercises which you can do it from the, these are the tongue exercises which will be helpful to you. Now, coming to the oropharyngeal exercises, that is the exercises which will help to increase the amount of cavity room inside the oral cavity and the oropharynx. These are that you have to make the puff you have to puff your cheeks, then the air should not come out so that your lip should be pressed. This is the exercises. This is then you say that humming. This is with lips together, keeping your lips together. And now your this thing is and jaw movements. It looks odd, it looks awkward, but you have to do it because it is an exercise. Movement of the jaw, that is the mandible. Mandible to the left and right, both sides we have to move it. And one more thing is that I would like to bring your notice that some palatal movements, soft palate, exercises of the soft palate, so that we have to open your mouth and they say ah, 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 so that your palate should, the palatal movement should be there so that the palatal muscle tone will increase so that palate will not, the soft palate will not fall back. These are the. Now coming to the cervical exercises so that the fat present in the cervical area will compress and reduce the amount of airway which is present from the nose to the larynx and lungs. this airway will be compressed. To reduce that, if we remove the fat in this area, to reduce that area, we have to do cervical exercises. One is shoulder exercises. These are the shoulder exercises. Both rotational shoulder, rotational exercises, which will reduce the fat from here. Now, then you have to do that front and back. That is this way, back, front, back. Then side to side, side to side. Then this way. Then rotation, which is complete rotation of the neck, clockwise and anti-clockwise. These are the exercises, cervical exercises, and we have to do it against resistance to increase the tone of cervical muscles. So that we have to hold like this chin, then push it below. This will increase the tone of cervical muscles. And hold on this thing like the cheek and push it against the hand. This side you keep it here, hand, and push it against the cervical. These exercises will increase the tone of cervical muscles and reduce the fat in the neck. And it will increase the roomway. It is the area inside the oral cavity and air, that is respiratory pathway. And it will reduce this thing, and it will help for to reduce the snoring. Now I will be showing about respiratory exercises which will help in solving the snoring problem. It is in India it is called as pranayam or yoga, and they are the all respiratory exercises. First of all, it will be the 5 pranayams mainly which have been taught. That is, first thing is Bhastrika, second one is Kapalbhati, third is Anulom Vilom, fourth is Brahmari, and fifth is chanting Om. Or in Western world, that is they call it chanting, that is saying vowels A, E, I, O, U. It is like that. Now we'll start with Bhastrika. That is breathing forcibly, breathe out. Now, second one is Kapalbhati. Kapalbhati is, that is, you have to breathe in and forcibly breathe out. Third thing is Anulom Vilom. This is also most important. You have to close one nostril, breathe in, and breathe out from the other nostril. Now, breathing from this nostril, breathe out from the open nostril. This we have to repeat it many times, around 10 times, 20 times, 50 times, like that, so that our airway will be clear. And now, fourth is Brahmari. Close the ears, then say, don't press it, just place the fingers on the forehead and the chin, then say, there should be echo in the ears. This is the fourth. Fifth is chanting Om. Om means continuously you have to breathe in, then by these exercises, respiratory exercises, that throat, that is the respiratory tract whole from the nose up to the larynx, it will be clear, and hence there will not be snoring. Snoring will be reduced. And most important thing is singing also. If you try singing, and singing helps all the muscles in the neck. There will be multiple muscles will be involved, and so many vowels will be pronounced, and so many rhythms will be there, and hence singing also helps in reducing snoring.